Hi, I am Dr. Sasikanth Maddu, Senior Consultant, Plastic, Cosmetic, Craniofacial and Hand Surgeon. Breast reconstruction after cancer surgery. Breast cancer is one of the most common cancers in India and worldwide. So, for breast cancer, depending on the stage of the breast cancer, a lot of treatments are being done, like small quadrantectomy, partial mastectomy, complete mastectomy with axillary dissection. So, there are a lot of treatments that are being undertaken for breast cancer. So once breast cancer treated, it can be completely removed or it can be partially removed. So depending on the defect, we have multiple options for breast cancer. For example, if the breast is completely taken away or there is complete mastectomy was done. So in that situation, the affected side will be flat with a scar on it, horizontal scar on it, or a scar on it depending on the type of the incision that take up for removal of the breast cancer. So how do we do reconstruction? So there are multiple ways of reconstructing breast after a removal of the breast due to cancer. One is either using a implant or a foreign body like a silicone implant. The other by using one's own tissues. So these are the two ways. So for implant based reconstruction, there are certain things which we have to comply with before, like the treatment of the cancer in addition to the surgery, chemotherapy as well as radiation, that should be completed. And after radiation is completed, we wait for a few months and we can start the process of reconstruction by implants. So once the radiation is done and the skin changes, comes back to the normal and the skin becomes supple, we put a expander implant beneath the skin. And we slowly increase the size of the balloon or the implant by injecting regularly normal saline solutions through the injection port over the period of next 2 to 3 months till we reach the requisite size. Once we reach the requisite size, we replace the same implant by a silicone implant of the particular size for the reconstruction. This is implant based reconstruction. Sometimes we do not choose implant based reconstruction. Sometimes some people might choose their own tissues. In that situation, one can do reconstruction immediately after the surgery. During the surgery only, after the resection is done, we can immediately reconstruct the breast. There are multiple options. If depending on the need of the breast tissue, the amount of breast tissue that has to be reconstructed, as well as the ease of the procedure. So how fast the procedure can be done. So we have multiple options like DIEP flap. DIEP flap is the flap for deep inferior epigastric artery flap, which we take it from the lower abdomen, skin from the abdomen below the umbilicus. It is generally supplied by the particular vessel called deep inferior epigastric artery, and that based on that blood vessel, we take the flap along with this blood vessel, and we replace the tissue over there on the defect and anastomose or join this blood vessel, deep inferior epigastric blood vessel, with internal mammary vessels, which is in between the ribs. So that ribs and the sternum. So we have to dissect that out, bring that vessel out and join these vessels, the deep inferior epigastric artery as well as to the internal mammary vessels. Similarly, it can also be attached to thoracodorsal vessels also. So in that way, we re-establish the blood supply to the skin and the flap which we have taken from the lower abdomen, and we have replaced it in the place of the breast. So this is a bit long surgery. Sometimes if the surgery, if some patient doesn't opt for long surgery, we can go for latissimus dorsi flap. Latissimus dorsi flap is the skin flap along with the skin paddle over it. The latissimus dorsi muscle is a back muscle, a thin flat muscle that is there on the upper back of the particular person. It's a triangular muscle, and we harvest the muscle along with the skin over it, overlying skin, and the size of which we measure based on the defect of the after removal of the cancer. So accordingly, we rotate that skin along with its muscle into the defect from back to front, and we will fix the breast. So the limitations of the latissimus dorsi muscle as well as the limitations of the DIEP flap are: this is a long surgery, this is a short surgery, and sometimes we don't get that requisite amount of volume for latissimus dorsi flap, whereas we get good amount of volume if we include both the sides of the lower abdomen. Then we can include a much bigger flap for DIEP flap. The disadvantage of the flap is this long surgery for a DIEP flap. So there are multiple options depending on the size of the demand that requires. So we decide on the type of the flap. So, and whatever the flap may be, sometimes it is not enough if there is a opposite size breast size is bigger. So in such situations, what we can do is, once the wounds are healed completely, once the sutures are healed, when the breast becomes healed and becomes supple, reconstructed breast, we do fat injection. Fat injections means autologous fat injection. We harvest fat by liposuction from the stomach or thighs of the particular person, and we treat it with we centrifuge it at 3000 rpm till and we concentrate the fat, and we inject the fat into the breast, and we increase the size of the breast. So in that way we can match it to the opposite side. So these are the few methods of reconstruction of the breast after cancer surgery that we can discuss here. So whatever the breast size may be, whatever surgery we perform, we should understand one fact, that we cannot make it exactly the same replica as a opposite side breast. So we need to understand that it's reconstruction and we are not recreating the same breast. So in that way we can alleviate, or we can treat the problems associated with the breast removal of the breast due to cancer.